you can absolutely still have a vaginal birth after cesarean. In fact, if women who actually decide to try, who find a supportive provider and head forward with a vaginal birth, very high percentage of them are able to give birth vaginally. It's a very low percentage that are not after you've had a cesarean, specifically listed as CPD. So keep that in mind. And then your job will be to find a really supportive VBAC provider or vaginal birth after cesarean provider. Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. Starting off this episode with one of my favorite things to do, and that is reading your testimonials. This one is from C. Gerber. She says, "Thank you. I had an incredible first birth experience." Yes, that is always the goal from the very beginning, right? "I found your podcast halfway through my first pregnancy and ended up buying your course soon after I listened to many of the birthing stories. I ended up having my firstborn daughter after only 7 hours of labor with no pain medication. It was an intense but amazing experience that I was able to have control over the whole situation. This course helped me take control of my first birth and allowed me to go into my labor confidently. My doctor was blown away at how fast I had my first child, and my nurse was also amazed. I told them about this course I took, and my nurse wanted to know what it was called so she could tell other women about it after witnessing my birth." That's awesome. That is so cool. Honestly, anytime that we're able to have good experiences and share it with other people, I don't care what course it is, if you have a good experience and you use whatever you use, share it with the world. They deserve to know. They deserve to have the experience that you had. You guys, this episode today, it has me cracking up. It's all so true. I want you to hear it with a light heart and also know the reality of these lies that you're going to be told. But whether it is well-meaning family and friends, the media, or even your provider, yes, it can happen. You are not being told the complete truth when it comes to your pregnancy and birth, and that is the reality of it. So I am here to debunk some of these things for you. And truly, there's a ton more than 7, and you know I can go on, but these are the ones that I probably hear the most. So let me know if you want a part 2. You would reach out hello@myessentialbirth.com or reach out at myessentialbirth on Instagram. Now, number 1, the most common and most irritating one, in my opinion, is that you should schedule an induction if you are coming up to your 40-week guess date. Now, they're going to say due date. They're going to tell you that you really can't go past this and all of that kind of stuff. But if you've been following along with me for any amount of time now, you know that this whole induction thing has kind of become my soapbox. This is not evidence-based. We are given guess dates. They are not due dates, meaning that your baby is expired the second they go past that 40 weeks. We ovulate at different times. Our cycles do different things. The sperm goes into the egg at different times. We implant at different times. There is no 2 people giving, even with the same cycle and all of the same information, that are going to go into labor at the same time. And of course, I'll say that, and you'll be, but my sister and I, whatever. The reality of it is we are all individuals. Our babies get to choose the time. That is the coolest part. If you did not know that, it's actually your baby that sends that hormone signal to your brain that says, hey, we're ready. Let's do this. So your baby knows exactly when they're supposed to be here. So let's not mess with Mother Nature unless there's an actual reason to be doing that, right? So kind of the joking, like your baby can't read a calendar. They have no idea about that, but they know when it's time to be here. I also want to stress too, your body has incredible ability to grow. Like, you are born with a uterus, you are born with eggs, fallopian tubes, all of these things, vagina, cervix, all the stuff that you need In order to nourish, you even grow a placenta, you grow an extra organ for your baby. So don't tell me that your body is not smart and doesn't know exactly what it's doing. You grow all of this stuff, including your baby and your body know exactly when it is time to give birth. So let's not pretend that once we hit some guess date mark that everything goes downhill and it's all crap from there and your uterus stops working and your baby's not going to be healthy and well. That is a lie. Now, of course, there are going to be exceptions to the rule, and you should work carefully and closely with your provider. But I guarantee you 100% that if we were not forcing women into inductions, usually they're asking you to schedule it by 37, 38, 39 weeks. If we are not forcing them into inductions, medically induced inductions at week 40, you would have a ton of women that go into 42 weeks or go into labor 42 weeks and after. And I've seen it. I've seen it when women are left alone and allowed to do their own thing, that it's not abnormal at all to see a mom that gives birth at 42, even 43 weeks. So keep that in mind. Your placenta doesn't give up at 40 weeks. Your body is still functioning and helping to nourish your baby. And truly, every day more that baby is in there, and they tell you this with preterm babies, right? But the second you hit 40 weeks, it's like, oh, now it's the opposite way, right? Every day that your baby is in there, they are growing. Their body is healthy and strong. They've got stuff happening with their lungs and all these other things that are going to take care of external factors once they're born. It's powerful. So I will say, though, most providers, and this includes for if you are having an out-of-hospital birth, depending on which state you live in and what the regulations in your area are, if you are having an out-of-hospital birth, they will tell you if you do not give birth by 42 weeks out of hospital, then you will need to transfer to hospital in order to give birth. So definitely information to have for yourself in case that's something you're coming up against. And if that is the case, if you are getting closer to that 42 weeks and you are planning for an out-of-hospital birth, or you are, being really forced into having to deal with providers on these forced inductions, then we start talking about all the things that you can do to jumpstart your labor, including castor oil and some other things. But different topic. I'll actually put the link to the Jumpstart Your Birth in this episode. So if you guys have questions and you're like, oh, shoot, that's me. Yes, please. That you can find that information right there. If you are in a hospital setting, you will probably have some extra monitoring. That's definitely something that you can do and recommend to the provider. Like, hey, I know I'm going over my quote unquote guest date. I would like to do some non-stress tests, some extra monitoring, and keep track of things that way. Or you can just say, I'm fine. Thank you. When I start having contractions, I will come in. What are they going to do? They can't force you to come in and get checked. So totally on you. This is one of those questions. Ask this at your prenatal appointment. Ask at a prenatal appointment, what do you do when women, such as myself, come up to their 40 weeks? Do you do scheduled inductions? Do you require something like that? Are you totally fine with my body just doing its own thing? What does that look like? We're also going to include the list of questions that you can ask your provider. If you have not downloaded that yet, we have one for hospitals and OBs and midwives in out-of-hospital situations. Download both, look at the questions, take them with you. Now, number 2, and this is for my petite moms, but it happens even if you are not petite, even if you are just, I don't know, it happens, okay? So how about your pelvis is too small to give birth vaginally? What? Even if that came after giving somebody a vaginal exam, you have no idea what you are saying. I'm sorry, provider or not. That your pelvis moves, like you have relaxin, the hormone relaxin. It literally like stretches and helps pull things apart. Your baby, they have the reason that their little head plates are not formed and hard until a while, months later after giving birth, is quite literally so they can fit through the birth canal. So you have head molding. Have you ever seen a baby that looks like an alien after they're born? Like they just have this like elongated, like massive oblong head. That's because that's what they needed to do to fit through the uterus, to fit through the vagina. That is very real. So your pelvis is moving and stretching. Your uterus is doing its thing. Your baby's head, all those little plates forming over itself, doing all these weird shapes. And then your baby is pushing against your uterus with their feet, turning and twisting like a key, working through. They know exactly what to do. And we do not generally create babies that we're not able to give birth to. Now, if we're talking about separate things such as gestational diabetes and you're really like that baby's really gaining weight. And we have episodes on gestational diabetes too. So gestational diabetes does not mean that you will instantly have some massive baby and that it needs to be taken care of in any other way than a vaginal birth. But I'm just saying, if there are some outside factors and different things to have a conversation about, that's one thing. But telling a woman from the get-go that you have like cephalopelvic disproportion, CPD is kind of what they call it. These are like the number one things that we see on the cesarean birth cards. Like when you read like reason for cesarean, it's like, oh, well, something was wrong with the mom's uterus, right? Put it back on the mom. That's why we did that. And things like that. So just know that your body is totally capable of growing a baby that fits in your belly and can make its way out of your vagina. So anyways, again, I get a little frustrated with that kind of talk as well. But there is a lot of movement, a lot of things that happen. Laboring positions are a big part of it. So if you are planning to have an epidural, that's fine. There's nothing wrong with that. You absolutely get to choose. Benefits and risks to everything, of course. But if you're planning to have an epidural, then what I would encourage you to do so that you're not having to worry about, oh, well, your pelvis was this and that, whatever they're going to talk to you about, is you make sure as much as you can that you get farther into the labor before you ask for the epidural. So like wait till you really, really feel like you would like to utilize it for whatever your reason, for pain, for emotional, for whatever. And then you work from there to make sure that you are not just flat on your back. You ask for help to change positions. So you should be having somebody roll you side to side, using the peanut ball or the stirrup to put your leg up when you're on your side so that you are opening that pelvis. You're allowing the baby to rotate and move, because what happens a lot of times is we have these epidurals and we put moms on their back, even in a 45-degree position. But if you watch a laboring mom, that's not what she's doing 95% of the time. She is walking. She is moving her hips. She's using stairs. She's putting a leg up. She's bouncing on a birth ball. She's sitting over a toilet. She's just, the rocking and dancing back and forth. There is so much movement that mom is doing because mom and baby are working together to get that baby down and out. And if you have an epidural and you're in a bed, you need to mimic some of that or create some of that so that they can do that same thing. So don't get stuck on your back with an epidural if you have it. So things like squatting and kneeling and walking and swaying and side lying with a leg up, all of those things are going to support and help a baby come down and out. Doesn't matter how tall or tiny you are, right? Cephalopelvic disproportion, that is something that is so rare. It does happen. That it means that there is like a disproportion to your uterus. You have a malformed pelvic area, some kind of injury that happened when you were younger. These are the kinds of things that we unfortunately see in underdeveloped countries where they don't have proper nutrients and things, and so their bones don't grow correctly. But to put that on the amount of cesareans that are given in the United States as the reason for the cesarean, something is wrong. And along with that, if for some reason this has been your story in the past, because this was my story, right? Then know that moving forward, you can absolutely still have a vaginal birth after cesarean. In fact, if women who actually decide to try, who find a supportive provider and head forward with a vaginal birth, very high percentage of them are able to give birth vaginally. It's a very low percentage that are not after you've had a cesarean, specifically listed as CPD. So keep that in mind. And then your job will be to find a really supportive VBAC provider or vaginal birth after cesarean provider. Number 3, you do not have to consent to cervical checks. Ever. Take a breath. Listen to that. Ever. You don't have to have them when you are pregnant. You don't have to have them during labor. You might go into the hospital and they might say things like, well, we can't admit you if we don't check and you're at least 4 centimeters. And that might be their policy. That's fine. But you can sit there and labor and give birth right there without them ever touching your body. So I would say that's absolutely a conversation to have with your provider, and have it beforehand and have it on your birth plan if that is what you are choosing to do and how you choose to proceed. Some women like to have cervical checks. They kind of like to see where they're at. They're curious, that kind of stuff. Totally your choice. But if you don't want one, you never, ever have to consent to one. I also want to tell you guys, because this is something that is not spoken about enough, I think, cervical checks don't tell you anything. They tell you, let's be fair, they are a piece of information. They don't tell you anything in regards to when you are going to give birth. And that goes for prior to being in labor as well as during labor. So they might get information. For example, if you are looking up to, or you're up against an induction and they're trying to decide if they should do that, how successful it would or would not be. And we do something called a Bishop score, right? And the reason I ask when moms come up to an induction, I'm always asking, what was your Bishop score? It's because the majority of women tend to get cervical exams. Now, you don't need one, and in which case you wouldn't know your Bishop score if you're coming up against an induction. But if you are considering one, at that point, you might want some information so that you know how much medically they're going to have to do to get your body ready to be able to go to get labor started and progressing properly. So what they do during a cervical exam, and they're looking for Bishop score specifically, most of what you're going to hear is you're this many centimeters dilated and this much percent effaced, right? So your cervix is open this many centimeters and your cervix is this thin percentage wise, right? So that's the information they're going to give you. But there's also, where is the location of your cervix? Is it ripe or really soft and squishy, or is it hard? And what's the station of your baby? How high or low in your pelvis is your baby? And all of that information can be totally useful, again, if you're coming up against an induction. As far as providers using it because they're trying to talk to you about that 40-week induction, and at 39 weeks, you have a cervical exam, and they're like, your cervix is totally closed and it's really hard. I think we should probably schedule that induction. This baby doesn't look like they're going anywhere. Or for somebody to say, well, you're 3 centimeters dilated, you're 80% effaced, you're probably going to go into labor this weekend. Neither of those are true necessarily. You can have a mom that is totally closed off with an unripe cervix and all of that stuff, and they can go into labor in 24 hours and have a baby. And just like the other way, I have had women who, I am not making this up, 6 centimeters dilated, 80% effaced for 6 weeks prior to starting labor. That baby did not fall out of her. She did not go into labor over the weekend. She held on 6 weeks, and when it was time, she gave birth to that baby. So keep in mind, that doesn't tell you anything. The other thing that they're going to use it for, right, is during labor. If you don't have cervical exams, that could be on your side, especially if you're having a longer labor, which can be totally normal. If you get checked on your way in, for example, and they say you're 4 centimeters dilated and you're having contractions, we can bring you in. That's great. But then they check you in 3 hours and it's like, well, you're still 4 centimeters dilated. We might have to XYZ, start Pitocin, talk about this, whatever they're going to say. That, again, I've had a mom 4 centimeters dilated, give birth 10 minutes later. I have seen it firsthand. Don't tell me it doesn't happen. We do not dilate by the clock, but if you are receiving cervical exams during your labor, they will be looking at the clock and looking at your dilation as you go, 100%. So you need to know that before you head into your hospital. So maybe you decide, actually, I don't want any exams, especially if things don't look like they're quote unquote going your way. Keep all that in mind for when it is birthing time. The other thing is cervical exams are not comfortable at any time, but especially during labor. Everything you're feeling everything during that time. So you have to lean back to have the cervical exam most times, right? Legs wide open, probably not a comfortable position. You're going to have at least one contraction in that position, most likely. And then messing with the uterus or that vaginal area during that time, it just irritates everything. It's super painful, not everybody feels that way, but it's very, very uncomfortable to be measured during labor. And then right after, the contractions are so much more intense for the next couple contractions. The whole thing, all to get an idea of what's going on inside. And it's like, maybe we don't need to be in there, So keep that in mind. The other thing is cervical exams. Good for you to know they can introduce bacteria, right? Anytime, even though it's good bacteria in your vagina, anytime that you, even with a gloved hand, sterile stuff, push good bacteria into a place it's not supposed to be, like up towards your cervix, you can create a risk of infection. And then we always say, and hopefully they won't offer, but when your water is broken, that is definitely a time that you really want to limit cervical exams because you have an open area where you can cause and create more of a risk for infection. Hospital births tend to be a little bit more pushy about this. So again, if that's something that's important to you, you want to make sure that you have that on your birth plan. Midwives, either in a hospital setting, birthing center, or at home, they do tend to be a little bit more lax on that. But again, no matter where you're birthing or who you're birthing with, that is time for you to have a conversation with them if this is important to you. And overall, I just want to make sure that you know, like, you are in charge of your body. Just because there's people in white coats, even with good intentions around managing, so to speak, your birth, you have the final say on your body. Just going to leave that there. Number 4, your only option for the gestational diabetes screening is the glucola drink. False. If you haven't heard that yet, you heard it here. You do not have to do the glucola drink. There are all different kinds of things that you can do. You have many options. One of them is to choose a different food or drink that is not the traditional glucola drink, right? All moms are really trying to like be their healthiest and do their best, even in taking the test. Like because they want to know, like, where are things at, and am I healthy? Is baby healthy? Before we get into those options, the different things that you can do, you can say no. You don't need to have this test necessarily. Like, you get to choose. You not any kind of medical advice here, but you can say no. You can say no to any kind of testing that comes your way. You do not have to do it. There is no force that is behind that. You do not have to do that. Should you decide that you would like to do it, but you don't want to drink the glucola drink, and the reason that women don't want to is because there's all these added gross things in there that we try not to do or take into our bodies when we are pregnant. And so other moms are like, how about some bananas and peanut butter and toast and raisins? Or how about, that sounds really gross, but I'd love some jelly beans because I don't do that all the time. Or whatever that looks like. Some providers will offer a separate, here, you can try these different items instead. And some won't. But when they don't, we actually, and I'll include the episode that I did with Jackie Berg. She's the creator. She's mom. She's the creator of the Fresh Test. And somebody had actually mentioned this within the birth course in the Facebook group. They talked about the Fresh Test in there. And I was like, what is this? That is so cool. I went to the website, looked it up, looked at the ingredients, looked at all the information. I was like, this is killer. I have got to talk to this woman. So I invited her on and I was like, please educate everybody. This is so awesome. And so Fresh Test it's a little packet. You can bring it instead of the glucola drink. They're saying right now like 98% of providers are approving it because it has a certain amount of whatever. She went over all the details and scientific stuff that like this is exactly how much is in each one. It should spike your blood sugar like this and that. It is totally accurate. So bring that to your provider. And we have a code for that one. I'll put it in the show links, but you get 20% off with code all in caps, all one word, My Essential Birth at checkout. That is something that I think if moms are doing it, that's the one that they should use. That is my personal opinion. I think it is the best out there, unless you want to do food. The thing with food, and she talked about this as well, is it's not perfect, but my opinion, it doesn't have to be perfect. So again, you get to choose. The other thing that you can do, maybe you don't want to do any of that, you get a glucose monitor and you monitor your glucose for a little bit. Like, you can just prick yourself little bits and check it each day and you get to decide. So anyways, that I just want you to know that you have lots of options in that way. Number 5, your baby is measuring big, quote unquote big, on a 3rd trimester ultrasound. So you need to be induced. Have you heard that before? And if not, I hope that you are not going to anytime soon. But this is a thing. So it's so silly to me. We know, evidence-based, for real, that ultrasounds are not a good measurement of weight or even length for a baby, but specifically weight. And so when you are telling a mom, based off of something that can literally be pounds off. I'm not talking just 1 pound. It can be 2, even more pounds off, either more or less in either direction. And you are making an incredibly medical decision off of that you need to be induced because your baby is so big based off of this ultrasound. That's a problem. That is not evidence-based care. And I don't love it at all. We know that measurements as far and along with that, right, whether that's a big baby or they want to move your due date, I'd say those go hand in hand. Using a 3rd trimester ultrasound to move a due date because now baby's measuring bigger. It's like, what? If you had an early ultrasound and they've already said this is where the dates are, you don't go messing with that date later. The only time that would be acceptable is if you're saying baby's measuring a little smaller, we need to move your due date out a little bit, but never, ever, ever move a due date up. I think the only way would be to move it out. The biggest worry or concern is when they're talking about a big baby, and maybe there's other things that are involved. Maybe it's not just the ultrasound and they're saying it's ultrasound and you have gestational diabetes and your fundal height, and we've got some other things that are indicating to us that this might be an issue. Still a conversation to have. The concern is that they're concerned that baby's going to be so big they can experience something called shoulder dystocia. So their head is born, and for whatever reason, those shoulders are lodged. They say often because baby is just so big and chunky. But let me tell you this, we have women within the course, and this is, I love now, our Facebook group has certainly grown, and they just give all the stories. Like, oh, I had a 10-pound baby. Well, I had a 12-pound baby. I didn't even have gestational diabetes, but I had, a 12-pound baby at home, whatever. Babies are going to be what they're going to be. Our bodies stretch and move and grow what they grow. Now, sometimes there can be issues. Shoulder dystocia is something that can happen during labor, and that's something to be aware of. But it doesn't mean that you're going to experience that. And it doesn't mean that a baby with shoulder dystocia cannot be helped through and have zero issues at all, too. So as scary as it may sound, there are other sides to the story. And so that is something for you to know and something to speak with your provider about, kind of like a one-on-one thing. Now, as far as evidence that we found in regards to shoulder dystocia, 14% of babies that weigh greater than 9 pounds, 15 ounces at birth will experience shoulder dystocia. So if you're interested in what the actual facts are, that is one of the numbers that might interest you. But again, you don't know how big that baby is before they're born. So this is a guesstimate, right? Small babies can experience shoulder dystocia too. So again, this is not just a big baby thing. It's much less. It's 0.6% of babies weighing less than 8 pounds, 13 ounces. But tiny babies can also experience shoulder dystocia. In most cases, like I said, it's resolved pretty quickly. And if you're a healthy mom, it's likely your baby's not going to grow too big for you to be able to give birth to them. Some other concerns have to do with unplanned cesareans, which inducing mom when her body and baby aren't ready can absolutely lead to that. So if they're concerned about a big baby and they do an induction, it could lead to that cascade of interventions that is not just an induction, which induction in itself is invasive, right? They're putting things in your vagina to ripen the cervix or to stretch the cervix. You're hooked up to monitors the entire time. You're likely going to be given Pitocin to get contractions going, which 9 times out of 10, they're going to keep the Pitocin on, even though there is a chance that you could drop that Pitocin down and your body could kick into labor on its own. But most likely you're going to keep that Pitocin on, which leads to more difficult contractions. And so often moms who have inductions, not always, and I talk about it on here a lot, but often moms who have inductions tend to go for the epidural because the induction takes a long time, you're tired, and then the pain from the Pitocin contractions is different than a regular contraction. So we're just dealing with all these different factors. And then that epidural and Pitocin and time, and maybe they broke the bag of waters, and that can lead to a cesarean birth. So that is a risk involved with inducing a baby earlier. Also, as I said before, every day that baby's in there, they're creating hormones. Their lungs are developing. Their brain is developing. Like they're getting nutrients that they need. All this prep work for when it is labor time. So we really don't want to disturb that. Mother Nature is very smart. Perineal tears is another one that, that could be a risk of, right? They say in part it's due to the need for vacuums or forceps. But again, if a baby is in the proper station and they're ready to get going and labor begins on its own, the need for those are much, much less, right? Very minimal to nothing. Postpartum hemorrhage is a concern. And then newborn complications could be a concern. So blood sugar levels, any breathing problems, birth fractures like a broken collarbone or a broken arm. This is obviously right if your baby is big and having issues coming out in regards to shoulder dystocia. All of these they're not uncommon with big babies, but it's not ruled out even if your baby is average weight. You may or may not have some of these experiences either way. But you get to consider the risk of birthing a suspected big baby because, like I said, ultrasounds can be a pound or two off. You have to decide if it could guess right or it could guess wrong. So if you do have a big baby, those are some of the risks involved. Then there's also the risk of induction, risk of cesarean. And remember, you get to make the choice. So that's all the information for that. Now, number 6, once a cesarean, always a cesarean. If you've heard this is an absolute lie. Obviously, I'm living proof of that. I know many, many moms that is their story as well. If you have heard my story at all, my first baby was a cesarean birth. The truth is that most women who have a cesarean birth, a prior cesarean birth, are actually excellent candidates to have a vaginal birth after cesarean. So put that information in your back pocket, get it in your head, tell yourself, I can absolutely do this, that once a cesarean is not, you absolutely need one. But probably the biggest thing that you're going to need to do for that next birth is find a provider who believes that same thing. Because it's interesting how many providers will immediately put you in the, well, or we'll do a TOLAC, right? A trial of labor after cesarean. But we're probably going to plan for another cesarean. Some things that you can consider if you've had a prior cesarean birth, and again, individual, and these things are not black and white. So these are just information for you to have. But if you've had a prior vaginal delivery and maybe that second baby was your cesarean baby, then obviously excellent candidate. You never know. Sometimes you have a baby that goes breech or whatever, like things just like end up weird for whatever reason, but it was your second and you've had a vaginal before, absolutely a great candidate. If your cesarean was due to failure to progress, that's like a common one, right? Especially with inductions. And that does not mean that you need another cesarean. If you are under 35, obviously excellent candidate. I'm going to say if you're over 35, same thing. This is like a numbers game. This is information that is out there. This might be what you have to push back with your provider a little bit for as well. But I will tell you, I'm over 35 now. If I got pregnant, and even though I've already had a VBAC, I mean, like I said, with my third baby, so I had a cesarean, a VBAC, third baby, they said, we don't care that you've had a VBAC, plan for another cesarean. No, I had a home birth that time. So if I were to get pregnant today, there's no way somebody's pushing me into cesarean because of my age. So, but they do say if you're under 35, that'll be less of a fight, right? Hopefully with your provider. If you've had only 1 to 2 prior cesareans, although I have absolutely seen women be supported and have VBACs after 2 cesareans, after 3 cesareans, and even after 4 cesareans. So again, case by case, work with the right providers. And they say the amount of time between cesareans can play a part too. For myself, I was about 14 months before I got pregnant with that next baby. I also like to say, and that was preference for how much I could handle for getting pregnant again. But I've seen women who have had cesareans and get pregnant very quick and they've been totally fine. I'm sure there is the opposite that existed as well, but I'm sure that you can have a baby 2 years apart and there can be issues or not either way too. So keep in mind, your body heals every day. It's doing that every day. So even when you become pregnant, before your belly is quite big and maybe stretching things a little bit more and whatnot, your body is healing even as it's growing that baby. So that is something to consider as well. But if you are with a provider specifically who's like, you didn't wait the 18 months, that's a red flag for you if you're looking to have a supported VBAC, because you could meet with another provider that's like, oh yeah, that's great. We'll just keep track of whatever and it's not even an issue. So again, information for you and so that you can take it to your provider. Being a healthy weight, and this is whether or not you are up against a cesarean or not, being a healthy weight, and I want to be careful how I approach that because by no means do I mean that somebody who is heavier cannot have a healthy, wonderful, excellent pregnancy. But anytime that you are doing anything for your body, right, in the way of nutrition, we should be looking to minimize the outside issues that we could be creating by putting unhealthy things into our bodies. So, but they do say, generally speaking, right, women with lower BMIs, and again, I hate that because that's really not what it's about. But you know if you're being healthy or not. You know if you have extra weight because of the choices that you're making or not. So the healthier that you can be, whether or not you are going for a cesarean birth, you will have less chances for interventions or other issues that can arise in the way of your health and for yourself and for your baby. And remember, when it comes to having a VBAC, that this decision relies heavily on your comfort level, your provider, your medical history, and whatever you choose that you want to do. There's no right or wrong answer. You get to have a say no matter what. But I did want to debunk the fact that if you had a cesarean, you absolutely have to have one again, because that is a lie. Now, taking us home with lie number 7. It isn't safe to birth outside of the hospital. That is a big fat lie. In fact, I say it all the time, but one of my favorite things that came out of this whole pandemic and 2020 business was all of a sudden, even insurance was offering to pay for women to give birth out of the hospital if they were healthy and low risk. If they could meet some of those things, they said, yep, totally safe. It's actually safer for you at this point because they didn't know exactly what was up with the whole virus thing and all that. Safer for you to do it out here. And women were choosing to do it anyways because they were keeping their husbands, their birth partners, their labor support. They were making all those people go out of the room, and then they were shoving masks on them during labor when you need fresh, wonderful, big amounts of air to be able to get through the process. So that was one of my favorite things because it's like, oh, all of a sudden, we're all going to agree and admit now that it's totally safe. But in my opinion, when there's some money involved and you can keep people at the place that makes money, then we're going to tell them that that's the safest place for them. Now, I'm going to tell you right now, wherever you feel comfortable, wherever you want to give birth with whatever provider you are happy with, that is where you should do it. I have no opinion either way. I think that is personal for every single woman. And I think you can do it safely both in the hospital and out of the hospital, 100%. So for a low-risk mom, no pregnancy complications, home birth can actually be a safer option in the way of listening to and respecting a mom's ability to go into labor on her own, listening to and respecting a mom's ability to work through labor during the process without having to be touched and manhandled and all of that kind of stuff. And generally speaking, when you have more of a hands-off approach, you're going to have less interventions. And so the risk is actually less if you are healthy and low risk out of hospital. Yes, you can have a beautiful hospital birth and you can have all of the wonderful things that you wanted. It just tends to be a little bit more hands-on, more medically managed, and a little bit more of a sterile environment. Generally, when you're out of hospital, whether that is at birth or a birthing center, it's more of like a bedroom experience. It's not so many beepings and noises, and you're not in a hospital, so it just feels a little bit different too, which does affect how we labor. The care that you receive from an out-of-hospital midwife is probably going to look and feel different than what you would receive even with a midwife, but especially with an OB in a hospital. It's, I would say, like more tender. They spend more time with you. They answer lots of questions. You feel like you're working through this together and you're not just a number. And I know for women, that's very important. They're also extremely skilled at normal. And so we've talked about this before, but obstetricians are excellent. They're also skilled at normal, but they have an eye for the abnormal, seeing when they need to jump in. And so sometimes we see things that might not be an issue that we're maybe they're a little extra careful about in the way of managing things, where it really could just be a watch and wait on the other side. So just different ways of practicing. And again, wherever you're comfortable, that's what you get to do. Certified nurse midwives, they go through a lot of training, and so they can attend home births depending on what state and all that kind of what state they're in and what the regulations are. But you may be able to find kind of that happy medium if you're like, I really want somebody who like understands the hospital side of things, but I want to be able to do it at home. Certified nurse midwife might be your answer. Used to be OBs would make house calls, like no questions asked. And if you're in a different country, this is like not, I mean, I'm kind of preaching to the choir, right? We have to fight for that kind of stuff here, or it's very rare for us to see it here. But in some other countries, it's like, yes, if you pick midwives and you want to have them at home or the hospital, that's just, they do either one. So, and OBs, some of them do house calls as well. Out-of-hospital midwives also carry supplies to resuscitate baby. They carry things most of the time, such as Pitocin or other medications in case mom does need some kind of IV drip or medication to stop from hemorrhaging. They are very good at managing those kinds of things. They're also, because they're very careful about what they do and they do respect the process of birth. This is the question that I get all the time, but what if I'm birthing out of hospital and something bad happens? Like, what if there's an emergency and they've got to call an ambulance and all this? And I'm going to tell you right now that the majority of times that transfers happen, they happen with plenty of time for mom and dad to drive their car to the hospital, you know, all their birth support in tow, to switch things over, for mom to get comfortable. It's not some big emergent event. Those emergencies absolutely do happen. I mean, these kinds of things are caught, generally speaking, much sooner. But if it does happen, it's a very small percentage of time. And the midwives have plans for this kind of situation. The other thing is if it happens postpartum, and that's where we see like, okay, we've got some postpartum hemorrhage or something that happened with the baby postpartum. They do have a certain amount of training that they can do right there and in like while they're waiting for an ambulance, if that is an emergent need. But they're able to suture mom up. They help with breastfeeding. They make sure everybody is cleaned and fed and all of that kind of fun stuff. They can even do the birth certificate. So they really are set up for the normality of birth. And the truth is, when mom is left undisturbed and she's comfortable, especially in her home setting, but even in a birth center setting, and all she's receiving is support instead of questioning, well, it looks like this is happening, so we might have to fill in the blank. Instead of that being like, yeah, your body is doing it. Keep it up. You're doing great. Like, I can't even tell you how much of a difference it makes to just have that emotional support and comfort and knowing like, if they're not freaking out, I'm not freaking out. Like, everything is safe and comfortable and good and we are okay. That is peace of mind, and it is wonderful to have beautiful, supportive people in such a sacred space, giving you all those positive affirmations and conversations and support. It's unmatched. It is beautiful. It really nourishes the mom in that space to be able to tune in, trust her body, and work through the process of birth. So now that I've given you the top 7, if you have more or you want to hear more and we need a part 2, absolutely reach out. But I hope you guys enjoyed this one, because I always want to encourage you to not take everything as like absolute truth, right? Take it at face value. Trust your instincts. Use your ability to ask questions and research things and educate yourself on all the options. That way you can make informed decisions, because that's what it's all about. This is all about supporting you, how you want to give birth, and trusting your body along the way to be able to do that. So I will see you next week. If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.